Hi, good morning and welcome. Thank you for attending and welcome to this meeting of the Adult Health and Social Care Policy Committee. My name is Councillor Argento. I'm the co-chair of this committee and I will chair this meeting. The meeting is open to the public. We have not received any question from members of the public. Please can I request that mobile phones and other such equipment are switched to silence, please, so as to not disturb the meeting. There is no fire test planned for today. If there is an emergency evacuation, please take instructions from the town hall staff as we cannot go through the ante room. The assembly point is Tudor Square. I'm going to start with introductions and I'm going to start with the members and then we'll take the staff, the officers that are up here, and if people can introduce themselves when they present their reports, that would be very helpful. Thank you. So I'm going to start on this side.
Sorry, I'm Councillor Steve Ayres. I'm Deputy Chair of this Policy Committee.
Anne Woolhouse, Councillor.
Councillor Martin Phipps for City Ward.
Councillor Ruth Milson.
Councillor George Lawrence Hammond, Councillor for Hillsborough Ward and co-chair of this committee.
Councillor Mary Lee from Darnell Ward.
Thank you.
Thank you, Chair. Sarah Bennett, Assistant Director, Legal and Governance.
Thank you, Chair. Good morning, everyone. John McElwraith, Executive Director for People Services.
And I have here at the front Fiona and, well, Claire is going, who are supporting us technically. Thank you. Are there any apologies for absence? Thank you. And any declarations of interests? Thank you. As I said, we have not received any public questions or petitions today, so we're going to go straight to item 6, which is the Adult Health and Social Care Overview. And this item is presented by John Brenner, Nick Rust and Alexis Chappell, I believe. Thank you. Whilst we wait for Alexis to log on, I just want to say that we are restricted for time, so we have 2.5 hours and we've got very full agendas. So I would be very grateful that when members are asking questions or things like that, you keep as concise as possible. I will keep a close eye on the time, and Fiona is going to nudge me if I forget to do so. So thank you.
So, thank you very much for the opportunity to speak today. The presentation is a report of the Director of Adult Social Care and how very much I hope we see ourselves going forwards. I would like to draw members' attention to our vision, our commitments and our approach in going forward across adult social care. It's when I came into post 16 months ago, it's one of the real opportunities I've seen in Sheffield was that everybody I spoke to really wants the best for the people of Sheffield, and that has been an overwhelming commitment from everybody I've spoke to since I've came into post. And what this is about is bringing everybody together to realise that ambition, to ultimately to be bold and brave for the people of Sheffield, and to ultimately improve the lives and outcomes for the people of Sheffield, and that ultimately is what matters. But equally, to improve the lives and outcomes for our care workforce, who have done a fantastic job through the pandemic and who've absolutely been really fantastic support and a real, I think, accommodation to, to social care. So for this presentation is based upon that foundation, that principle. And the vision and commitments were developed based on significant engagement and discussions over the last 15 months, and we really listened to what people had to say. But to the crux of it, and you'll hear this from later on in the delivery plan, is what people also wanted us to do was to create the conditions in which we deliver upon the vision and we deliver upon the commitments, and we have the conditions in which you'll hear from today about the care governance report, is the ongoing conversations and accountability and openness for listening and engaging with people as we go forward. To create the foundations for delivering upon the visions, we've very much moved towards seeing adult social care as a partnership of with members, with unions, with colleagues in health and housing and the VCSE, with individuals and carers. And that's how we very much reimagine social care to be. And very much all centred around improving the very best outcomes for people. And to that end, we've also implemented a new leadership structure, which is demonstrated in the presentation. And that's also about creating the foundations in which we can very much work in partnership with everybody, but also around communities across Sheffield and be close to communities, but also at the same time have defined portfolios, because what people really told us is that what they wanted to really do is to be part of discussions about what matters to them. So that's what our portfolio now reflects. And it creates us a capacity to take forward all the changes that people have told us that they want to take forward in social care. And what the final parts of the presentation also highlight is the context in which we work, the legal context, the frameworks, and the policy initiatives in which we're currently working to already. But I would say that, as I spoke to many members that are coming into post, is that adult social care, it really is the place to be, as well as Reflect is. It really is the place to be. That it's a place where there is a number of policy shifts, there is a number of legal shifts coming our way, but equally, based around all that, I think is an overwhelming commitment towards the people of Sheffield and to the communities and to improving lives and outcomes. So therefore, it's important that we have the foundations of a partnership and the foundations of a good governance and the foundations of principles of openness and transparency to ultimately to deliver upon that and going forward in a very practical and pragmatic way. So that's all I'm going to say.
Thank you, Alexis. Thank you for that. Are there any questions or comments from the members on this particular report? We are asked to approve the recommendations on this report. Apologies, I was reading the next line on the next item. So thank you very much. If there are no, I only have some, I just made a couple of notes myself. One of my bugbears, you already know, is abbreviations. So I think it would be helpful for everybody that, like me, forgets what the letters stand for, to have them at least the first time that they appear. It would be really good in anything that goes out in the public domain as well. And also just a question very quickly about where we are at with the vacancies and the people who are acting a role. Are those like in hand?
So great questions. It's a good question about language. It's something that really wants to work with colleagues about, is how we come to a shared language around health and social care. In terms of the recruitment to vacancies, that's underway, and aim is to brief members about the plans for that later on today, so that we have a very open and transparent process and going forward.
Brilliant, thank you. So we can move to item 7, which is the work programme, and I think Sarah and Fiona are speaking on this. Thank you.
Thank you, Chair. The committee's work programme is presented to you for your consideration today. This has been prepared for your consideration. It's items that have been suggested by officers that are for you to consider for future items. It is a living document, Chair, but these are the items at the moment that the committee has before it has suggested items for its consideration. And the recommendations for the report are that consideration to be given to any adjustments or you may want to request to the work programme, and that the work programme, noting that it is a living document, is agreed for the moment by the committee. So, yeah, the work programme is presented for the committee's consideration.
Thank you, Sarah. Are there any questions? Councillor Linders Hammond.
Thank you, Chair, and thank you, Sarah. I just really want to emphasise as one of the co-chairs that the officers have done a really good job of making sure that everything that may be necessary or desirable to have this committee's attention is within this document. Time scales and everything before this meeting have meant that between us as chairs and deputy chair, we haven't had the chance to have the in-depth look at the way we will suggest the committee that each meeting will be done. And I just want to reassure the committee and the public that we absolutely, on a cross-party basis, because that's what we are as co-chairs and deputy chair, will look at that and make sure that each meeting makes sense, because there's a huge amount on there and we can't deal with it all in the way it's currently put out, but also includes key priorities of members that may need to be added after this point, and I don't see this in any kind of a closed list. Thank you, Chair.
Councillor Ayres.
Yeah, thank you, Chair. Just want to endorse what Councillor Linders Hammond says, that I think that the purpose of this committee is to digest the reports that we've considered as the two co-chairs, myself as deputy chair cross-party, but also to, I think it's, the work programme has to be, sort of a living document in many senses, so that there is some scope for adaptation, bearing in mind that there are some crucial decisions that this policy committee will need to take over the course of the council year. Thank you, Chair.
Thank you. Is there anybody else? I just have just a couple of. I think it would be useful to know which items are time sensitive, so they have to be done at a certain time. So if we can have like something, maybe highlight them in a different colour, and then we know, because there will be things that will, crop up during the year, particular items that we may want to look into. So I think it's important for us to know which items are unmovable, as that we have to deal with them because there is a time sensitivity. If that could be looked into, that would be great.
Thank you, Chair. Yeah, I'm sure that's an addition that we can ask officers to make prior to the work programme being resubmitted to you at your next meeting.
Yes, and can I also confirm that all three groups have been involved in all the meetings that we've had so far. So we are truly making an effort to be as open and cooperative and collegiate as we possibly can. So, next item. I suppose I take there is no objection to accepting the work programme as it is, as a living document, but in principle, so that officers can go and start writing reports for September. I'll take silence as as agreement. Thank you. So, item 8 is the month 1 budget report.
Thanks, Chair. My name is Ryan Keyworth. I'm the Council's Director of Finance and Commercial Services. The report that committee's got before it today is very similar to reports that each of the policy committees and the Strategy and Resources Committee have already received or are about to receive. So the front of the report, which sets out the Council's financial position, and the back of the report, which sets out the budget timetable for 23-24, is common to all committee reports, with obviously a section inserted in the middle that's relevant specifically to this committee. The committee will note from the report that the Council is in a very challenging financial position, and this report effectively sets that out. Last year we finished £19.8 million overspent. The position actually improved quite significantly very late in the year due to last-minute one-off income, but obviously that position remains unsustainable, and as that last-minute income was one-off, it to a certain extent masks an overspent position that is carried forward very much into this year's budget. We allocated last year £70 million of the Council's reserves, £70 million of the Council's reserves to support the Council's financial position and to give us time and space to get back on a balanced and sustainable financial position. We've obviously used almost 20 of that now to balance last year's budget. We also used 15 of it to balance this year's budget and to set a balanced budget in March of 2022, so March this year. We also further earmarked 25 million of those reserves, so that's almost all of it gone, to give us some cushion against the challenging savings that were included in the 22-23 budget. We approved at Council £53 million of savings in the 22-23 budget, and we allowed ourselves £25 million of reserves to deal with any timing or delivery issues that arose in actually making those savings real. So, as it stands right now at month one, we are about £18.7 million overspent. That's the forecast at month one. About half of that we currently believe is a timing issue. So that's what the 25 million was put there for, to deal with timing issues and to allow time for savings to be delivered. You'll see in the detail of the report as relevant to this committee, we actually believe about 9 million of this committee's 11.6 million, I think it is, overspend, is actually a timing issue as opposed to a fundamental delivery issue. What the report also shows, though, is the significant investment the Council's made over time, and there's a chart in the report which sets it out, into both adults and children's social care. And that's in the context of significant government financial cuts to local authorities, not just this local authority, but right across the board over the last 12 years. So the Council's really tried to prioritise investment in vital social care services, both adults and children's, throughout this very difficult period of austerity. But that doesn't get away from the fact that we're in a very difficult financial position. We overspent last year. We're currently forecasting an £19 million overspend this year. The Strategy and Resources Committee received and approved a recommendation that each policy committee is required to live within its budget. That follows on from council resolutions that were passed both as part of the budget process and then subsequently in late March to finally establish these policy committees. So that leads me on to the kind of detailed position for this committee. So at month one, and it is early days, so there's time to improve obviously, we're looking at an £11.6 million overspend for this committee specifically. And that mostly relates to delays in delivering budget implementation plans, so exactly the reason that we set some reserves aside to manage. The most significant of the savings that are currently slipping relates to reviewing care packages that were in some cases put in place during the height of the COVID pandemic to support people to stay in their own homes rather than what would have normally happened in many cases where people would have been asked to move into care homes, for example. There have actually been fairly significant difficulties in recruiting staff to deliver some of these savings. It's a very difficult marketplace for the service to operate in, and recruiting staff who are skilled and experienced to make decisions, make judgment about care package reviews is proving to be difficult. It's worth just highlighting to the committee a couple of significant risks that it faces going into the future. And both really have the potential to have upward pressures on costs. First and foremost is the high level of cost inflation, price inflation that everybody will be familiar with, everything from starting with fuel prices and kind of working up from there. that will inevitably place upward cost pressure on both wages and contract prices. Secondly, there is a government-mandated fair cost of care exercise which we are required to undertake, which may also result in cost increases to the council. There may be government funding available to support that. It is unclear at this stage whether there is a match between any cost increase that we may face and any government funding that may result. And all of that is in the context of the pressure that has built up in services like this over 12 years now, since austerity began in 2010. That leads me on to looking forward to 23-24 and what will be a challenging budget process for this committee and for the rest of the council. There are no indications from government that we have that extra funding will be forthcoming. Any additional financial support that we find out about from government, and that could even come in the form of an ability for this council to raise council tax above the normal level that we've experienced in the past of 2%. We're unlikely to find out about that until the autumn statement, which typically is made in late October, which trickles down into a local government financial settlement about 2 months later, just before Christmas. That's how these timings typically work and have done for many, many years. That is far too late for an organisation of this size to use as an assumption in the budget process. So it really requires us to plan early on a relatively prudent basis, in the hope rather than the expectation that it gets a little bit easier towards the end. I'd much rather find ourselves in that position than to plan to receive additional government income that doesn't materialise and find ourselves having a very difficult Christmas period trying to work out how to take significant cost out of the organisation. So, the Strategy and Resources Committee will receive a report from me on the 5th of July setting out the Council's medium-term financial projections and a recommended approach to balancing each of the committee budgets. So that report effectively will kickstart the budget process on the 5th of July. That brings forward the start of the budget process by about 3 months from what we've done historically. Really important for me that we do that we get an early start on this because of the difficult financial position that we're in, and to give policy committees time and space over the summer, and that's what this does mean, is work over the summer period to understand the choices and options that you have to meet the budget targets that will be set for you by Strategy and Resources Committee, of which the chair of this committee is a member of that group. That means a report back to this committee on this committee's budget at the September meeting. We will then summarise all the reports to the various policy committees in a report to Strategy and Resources on the 12th of October. That should see us achieve a balanced position. It will then be for Strategy and Resources to decide whether it wants to alter that position from balance to balance by perhaps investing in some committees' work and asking other committees to identify further savings, for example. It's really important that we complete that process by the Strategy and Resources meeting on the 5th of December. That's the final step in this process. And that's so that we can complete the budget work in advance of full council on the 1st of February, which will set the housing rent levels for the following year, and full council on the 1st of March, which will set council tax and other budgets for the following year as well. That's all I wanted to say, Chair. Thanks very much, and obviously happy to take any questions.
Thank you, Ryan. Are there any questions, observations? Councillor Lyndon Hammond and then Councillor Lee.
Thank you, Chair, and thanks, Ryan. I wouldn't say it's good news, but it's interesting news that I think you said 9 out of 11.6, is that right, of the overspend so far in month one is really down to timing. I wonder, and I think within that you mentioned about that some of those staffing and recruitment things that are taking slow because of the difficult market at the moment are in that. If we look at the other part of the overspend, are there any particular issues which you would identify as major parts of the remaining month one overspend for this committee, which you would say are not timing issues that you haven't already flagged up? Thank you.
Thanks, Councillor Hammond. So yeah, essentially we are looking at a number of relatively, in the context of the size of the adult social care budget, we're talking about a small number, a small overspend in the purchasing and commissioning elements of the budget. Whether they can be turned around during the year, I'm not sure. It's, this is a month one forecast we're looking at here, so it is really very early days in the year. So I think that's part of the recommendation I've put in this report, that there's work commissioned by this committee from officers as to see what the options are really for getting on with the delivery of those BIPs, and whether there are alternative methods of delivery or alternative options that can be put forward by officers to deliver those budget implementation plans, and whether there, secondly, are ways in which some of those trend overspends, higher increases in costs or whatever, can be mitigated throughout the year. It's a very difficult market though, so I don't know to the extent that's going to be possible. That's really a question for officers rather than me.
Thank you. Councillor Lee.
Thank you. Well, very difficult, isn't it? It just, going back to 2011, 2010, when we had to go up to 50 million in that first year of the austerity, when austerity was imposed, and the base budget for the council was probably double what it is now. So, very difficult times. But my questions are we're going to be about recruitment, but about reviews, the high cost of care, and is the reviews across the piece, including older adults and people with learning disabilities, mental health, is it? So, what numbers of reviews are you going to have to do? And I know it is a very difficult process to go through, because it's not, you can't tick boxes, you have to deal with people, families, communities and so on.
I think Alexis is going to...
So we have a full report later on the agenda with the detail of the income expenditure and recovery plan progress, and absolutely the reviews are across all care groups. And what we have done though is taken a very much of a person-led approach, and part of our approach has been to have a very detailed review. The forecasts for this are based on us being a very clear check and challenge as to what we can deliver within a year. So rather than us doing, which I think has been done in previous years, is saying everything's going to be delivered within a year, and then you come to December and find out that it's not being deliverable, what we've taken is a robuster approach to say, actually, let's really focus on what are the pressures emerging, such as workforce recruitment, such as things like the cost of living crisis, that is actually impacting on our ability to go and undertake practical reviews of staff. But one of the things that we've done as a team is really refreshed and re-looked at and worked in a different way to look at completing the reviews that we need to complete within a year. And so hopefully the plan would be is that come next committee we'll be able to come back with a better forecast in terms of review completion. So that's a lot of the work behind the scenes. But what we have done, and I think this is my take on it coming to post, is that for me the robustness has to be always in the forecast. And from month one and putting in the check and challenge, it's not about, in a sense, saying that you're going to deliver everything 100% straight away. What you have to do is to have that robust challenge in the delivery focus, so that, as I say, you don't get to come to December and you find out you've got 3 months to go and find £25 million in a nutshell. So that's what we've done internally with adult social care, is taking that kind of approach and then working with colleagues in the finance team and legal colleagues to go and make sure that we need to take forward what we need to take forward. And often that means some very difficult decisions has to be made, and that is the context of some of the work plan for the committee, because that work plan reflects, unfortunately, some of the difficult decisions that we have to bring forward to meet the financial objectives.
Thank you. Are you happy with that reply, Councillor Lee? Or satisfied at least? Thank you. Councillor Harris, and then Councillor Phipps.
Thank you, Chair. I appreciate I'm in danger of moving on to the item 13, which is there's a bit of a crossover, but perhaps the response should come under that report. But clearly, the recommendation we're asked to approve today was to note the Statutory Resources Committee requirement. I don't know, repeat the wording because we've got it in front of us. my question is how, because my understanding is most of the other policy committees that have already met, I'm not sure the ones that haven't yet, I know there's one this afternoon, and I'm just wondering how other policy committees have approached how they are going to move forward on meeting that recommendation, just so that it informs this committee. And I'm not sure whether the response should come now or whether that should come more when we move on to item 13.
I think item 13 might actually in part answer the question as to how this committee should go about meeting that recommendation. Other committees have essentially done what the recommendation asks, which is ask officers to come back with plans to bring any overspends that exist back round. The most significant other overspend is in the Children's Committee, and that's fundamentally what the committee have asked officers to do.
That's fine. Thank you.
Councillor Phipps.
Thank you, Chair. And thank you for the report, Ryan. And thank you also for the report earlier, Alexis. Really appreciate that. It was good work. Apologies if Councillor Lee has already asked some or most of this. I just wanted to clarify how the strategic review is progressing and when would we see them come to the committee, if they will come here. The budget situation is really challenging, but can you assure us we can still contribute and input our opinions on these reviews, as I remember seeing some of the initial proposals and they were quite concerning, I felt, especially around proposed reductions in spending to prevention services, which could ultimately mean theoretically higher expense, you would think, in the future for like short-term gain. And just to confirm, when we're talking about the strategic reviews and the reviews mentioned in the report, they're separate from the BIPS figures mentioned, are they? Thank you.
A nice easy yes answer to your last point. They are separate. We put the strategic reviews in place as a way of trying to identify savings, yes, but also different ways of working in response to having to use £15 million of reserves to balance this year's budget. So there is a link between using those reserves and that budget. There's no assumption about delivery of any savings of strategic reviews in this committee's numbers as it stands right now. So any delivery of savings would actually appear as a benefit to this committee. Work is in relatively early stages on the early intervention and prevention review, which is the big one that really does affect this committee's work. As officers, we've received a couple of updates now from the project team working on this. John's actually sponsoring that piece of work across the organisation. And I think we're looking at the first results of that work more towards the Children's Committee actually rather than adults, starting to come out just before the summer. I think June, back end of this month, early next month. John, if I remember correctly from the other day.
If I can, Chair, yeah, that's correct. It's initially a focus on children's, and that work should be produced or available later this month, early next month. The adults, in conversations with Alexis, will probably be a couple of months after that.
But if I can just continue briefly, we are looking at spend on early intervention and prevention across the organisation of 50, 60, 70 million pounds. It's a really big number. So the question is how do we achieve the results of that work by working better together and better across the organisation without causing the risk that you highlighted, which is, am I simply squeezing the balloon at one end and it's going to pop out even bigger at the other end, as more intervention is required. The challenge and why it's taken a little bit of time to do is that the team are busy trying to work out how to avoid that specific issue.
Thank you. Just from me, in terms of, this is month one, okay, so month one was the end of April, wasn't it? So are there any indications of what the situation is like now, or is going to be at the end of the quarter, or are you not kind of prepared to say? I know that for our kind of committee, it's a timing issue mostly, but I'd be interested to know whether there is anything moving, really.
So the straight answer is I don't know the position at the 31st of May yet because my team hasn't finished the work on it. I find out either Friday or Monday. I only get to find out once they're happy with it, to be perfectly honest, because the last thing they'd want to do is to tell me something that I might announce here, and then it subsequently changes, so I don't know. Month one is incredibly early. We've been monitoring progress on budget implementation plan delivery really since about February, so it's not the first time we've ever looked at this, and we were producing internal reports to officers from kind of February on where some of these plans were, so that we could identify risks and issues. So it's not as early a forecast as a normal month one would be. There's obviously significant potential for this to move. We've still got 10 and a half months of the year left, so changes that are made today have a long time to implement. But no, I don't know the position yet.
Has just been hopeful there. Okay, so are we happy to accept the recommendation in this paper? Thank you, everybody. And I'm just going to look at the time. So we've got just under, good an hour and 54 minutes left, I believe. So we need to really be careful with our timing. We've got quite a few items to go. So if we could move on to item 9, Recommission Home Care Services. Thank you. I think Paul Higginbottom and Catherine Bunton are presenting this report, and there are some recommendations for approval coming with this report. Thank you.
Thank you for the opportunity to present our report today. I'm Paul Higginbottom, the Strategic Commissioning Manager in Sheffield City Council. I'd just like to start by just going on record by giving a huge thanks to all our home care providers and their care workers that have done an amazing job throughout the pandemic. They really have all been amazing. But as ever, contracts have end dates, and the contract is coming to a conclusion in April 2023. So the purpose of the report today is to secure approval for the commissioning strategy for the delivery of a new care and wellbeing service for adults, which will replace existing home care services. And the report's also highlighted how we've had to mitigate against the risks to home care, which run deep, particularly around recruitment and retention of staff. And as part of our duty under the Care Act 2014, we have to deliver a sustainable marketplace. The recommendation is that the Adult Health and Social Care Policy Committee approves the commissioning strategy for delivery of the new care and wellbeing services through a 7-year contract with a further option to extend for 3 years. In terms of the proposal, it is proposed that we take the opportunity to re-procure a new model of care through the care and wellbeing service, as I said, for that 7-year term. The challenges that the home care market faces are replicated right the way across the UK and have been a result of many years of underfunding from a central perspective. That has been exacerbated by the pandemic, which has only served to widen the cracks within the home care sector. So we are proposing to remodel provision in Sheffield, aimed at delivering the best possible outcomes for people in receipt of care through a high quality, consistent service, but with a real focus on our workforce. We have 1,800 care workers that represent our contracts at the moment, and we need to ensure that they have improved terms and conditions and can benefit from workforce development and career pathways, so we have a workforce fit for the future. We currently contract with 35 providers on the framework through 21 separate contracted areas. As a council, we have a responsibility to maintain oversight and quality and value of money and have that sustainable market in place. As Ryan alluded to earlier, we've seen large increases in demand for care, driven in part by the pandemic, where we've seen weekly care hours rise from 32,000 to 40,000 care hours a week. At the same time, the number of people in receipt of care has remained static at 2,500. We've done a lot of benchmarking across the country as part of our discovery piece of work, and we recognise that we are an outlier in Sheffield. We have 16 hours per week as an average home care package size, where comparator communities are at 14 hours. So there are at least 5,000 care hours per week more in Sheffield when compared with other health and social care communities. We've considered the demographics in Sheffield, the referral rates, as part of the care modelling, and that would indicate to us that the contract from May 2023 should include 34,000 planned care hours. In terms of the challenges the market's faced, it's really around the sustainability of the market based on its current level of investment, particularly around recruitment and retention. Providers report to us that they're losing care workers quicker than they can recruit. In fact, we have a 50% turnover of care workers in Sheffield in comparison to Yorkshire and Humber, where they're based at 35% turnover. The home care payment and charging model currently is based around time and task, charging by the minute, and within the report we have a consultation report that talks about moving to paying providers on planned hours and also charging on planned hours, which will create the environment where we can move to outcome-based service delivery, which focuses on what matters to the person. One of the financial challenges that we face as a result of the recruitment and retention issues within home care is that we've had to be more dependent on direct awards. These are from home care providers that aren't contracted, and it's currently costing us £4.7 million per annum and represents 11% of our total home care market, and we pay a premium for those services. So the proposed new model in the city is moving towards a community integrated care and wellbeing model with collective practice standards across adult social care and commission services that will seek to drive practice that is outcome focused, strength-based, community-connected and person-led. And it's all about fulfilling people's potential for independent living through that strength-based approach. As part of the new arrangements, we will also be empowering providers in that space around promoting independence through enablement and also through trusted reviews. And that's bringing the care closer to the person. And it also helps to build capacity within our assessment and care management services. So we're proposing to align geographically to 2 to 3 providers in each geographical area with a locality-based model with multidisciplinary collaborative working arrangements that build on that strength-based approach, where we can have far better collaborations with assessment and care management teams and the providers themselves. And we want to work with 15 high-quality contracted providers to move from an environment where providers are in competition to an environment where they're in collaboration, and we can all go on that journey to delivering outstanding care services across home care. So the challenge we face is managing that demand down and reducing the actual number of hours delivered by spring next year by 6,000 hours. We've done some work around financial sustainability in the market through a cost of care review. The cost of care tool has been produced by ADAS and the LGA, and it really starts to shine the light on a fair rate for the services delivered by home care providers. We've recognised through that work that the current rate of £9.05 pence per hour is insufficient and it doesn't support a sustainable market. And we would be proposing that we move to £21 per hour, but then that would be a journey towards the fair cost of care exercise, which is Ryan said is a requirement of central government. And we'll be doing that at a regional level across Yorkshire and Humber with ADAS. In terms of its contribution, it contributes very much to the one-year plan as part of our commitment to review home care services, recognising that the current position is unsustainable. It also contributes to the delivery of our new adult social care strategy, living the life that you wish to live. So it's very consistent and aligned with the wider strategic direction of adult social care. We've been working very closely with trade unions throughout. We are on a journey to deliver the charters under Unison and GMB, and we have referenced that in the proposed service packs to deliver the service from. We believe that the consolidation of 15 providers into consolidated geographical areas will reduce travel time and reduce the time carers are spending in cars, which will improve the carbon footprint and will have a positive response to the climate emergency, as well as encouraging providers under the service spec to move towards electric transport for their care workers. In terms of engagement, this is a culmination of 18 months activity where we've engaged with a whole raft of different stakeholders. We've listened to people in receipt of care who've had a really strong voice in helping to shape this piece of work. We've also embarked on a test of change for the new care and wellbeing model, which we're doing with a company called Foss Healthcare, which will go live on the 28th of June, and it will help inform and future-proof the new key components of the new care and wellbeing service. In terms of equality and opportunity, we've really focused on that throughout the soft market test and engagement with the market around equality, diversity and inclusion, and we've worked closely with Ace Sexton, who is the lead for us in adult social care, around this market. We understand we've got a diverse richness in our home care provision at the moment, and we want to protect that through the procurement process so that we can give the best possible services to people. We've also been inclusive in terms of the way we're procuring the contract, so we've encouraged our current providers to actually look at forming alliances to be able to support the move so that we are inclusive in terms of evaluating any bids. And I think that really concludes the actual report, and would just welcome any questions that anybody might have. Thank you.
Councillor Harris?
Good job. I really welcome this report. I mean, and some of the initiatives in it that, you know, we've been well aware of, and which I support, you know, the increase in demand, aging population and so on, but also recruitment and retention, which I've been banging on about in this council chamber for no end over last year or more. And of course, improving the outcomes for the people that we're delivering services to. I have a question, though, on the financial and commercial implications. It's paragraph 7.22, which talks about Sorry, I'm referring to the wrong paragraph. There's a paragraph there about. Oh, sorry. Yeah, it is 7.22. Improved collection rates. So there's a small increase in client contribution and improved collection rates. Now, how will collection rates be improved, and how will you know, what safeguards are there in place that you know, there is the ability to pay, you know, service users are you know, not unfairly disadvantaged in that process.
So thank you for that. Steve, if I can reply, we have the fair charging policy to make sure that we are fair and equitable, and we are means testing people on a consistent basis. The income collection is the fact that currently the way we charge on actuals is extremely volatile, and invoices change by the month, and it's a very complex process for the actual person in receipt of care to be able to understand. So the customer account service responsible for that income collection is inundated each month by invoice queries from people. The move to plan will give a more greater consistency in terms of what people are charged on a month-by-month basis. So we'd like to hope there'll be more confidence and there'll be more move towards direct debits, which will be very positive. But it also frees that team up. Instead of being in the heat of the battle around the queries of invoices, they can be more proactive and they can look at hardship for people and understand their circumstances, but they've also got more proactive time to actually focus on the collection of income at the same time. And we're attributing about £100,000 per annum to that improved process.
Okay, you understand my concern that so long as the hardship cases are being, that particular service doesn't diminish as a result of the change. That was my concern, really, Chair.
Thank you. Councillor Lindis Hammond.
Thank you, Chair, and thank you, Paul. It's been good to work with you over a long time on this, and Mercy, Catherine, not met probably yet, but I'm sure we will do. And also just want to say thank you to Joe, who's with us, who's been working on this for many years as well. Also moving on to work on different things, which is great, but it's good to see you here too. So I agree with them that said this is, I'm really, really pleased to see this. It's something that's been a long time coming, and it's funny to see this here at the start of a new committee. It's really good, actually, because it is actually a step change. A bit like the committees are a step change, this is a step change in the way that home care is delivered. I think I just want to highlight a few things which I think are really important to this. I think, for me, that more care will be delivered locally, and there's so many reasons that's good, but I think for our city's climate goals, it's important. You mentioned the electric vehicles, but also hopefully we'll get to a point where there's less distance needs to be travelled because we're managing that care much more sensibly. And we don't want our care workers going around the cities all the time if they don't need to. We want to be focused more locally. I think there's better terms and conditions are really, really important, and that comes through, I think, both the planned hours, which means that the providers should be in a much better position to provide better terms for workers, and obviously supported by that higher hourly cost of care clearly also puts that finance into that as well. So I think that's really welcome. And I also think that the more culturally appropriate care that will be able to be delivered through this model, and also different forms of providers and different ways of working, which, to be honest, I think I heard it from providers, from unions, from so many people. Time and task really only allows one way of doing things. It's resilient in its way, but it doesn't allow us to do different things and for different providers and different ways of working to happen. And so I really hope that will happen. And as with the last thing I'd say is also, I think this model can link so much better into the way we work more widely in health and care in localities, the team around the person, and so many other approaches. Again, the previous model wasn't really able to respond in the way that this model hopefully will. And so what you're seeing today is a start, but I think that, as a committee, we need to look a lot more about how we can get the best of this. I just want to not go negative at all, but I just really want to sort of ask a bit and draw the committee's attention to the Appendix 3 here. Actually, we are asking, in order to achieve that £21, there is a big ask in terms of achieving essentially a saving to get us there. I do think the trusted assessor model is positive, and actually working alongside the providers to achieve that is good. But I wonder if you can say a bit more about how that trusted assessor model and other mechanisms, as outlined in Appendix 3, are going to help us cover that gap, because actually it's a very big step to take, and we'll only get to what we need if that gap can be covered. Thank you.
Thank you, Joyce, and some really good points there. This is kind of my specialist subject. I could have had you all here for a day and talk through all the various things that we're doing, but sadly time doesn't permit. But in terms of that reduction in those hours, the one thing we are going to do is we're going to look to reprovision cleaning and shopping services. So where we're going in for the primary reason of delivering shopping and cleaning into people's homes, which can typically be between 1 and 3 hours each visit, we are going to look at how we can reprovision that, because we don't think that is the best use of well-trained care workers' times, and we've benchmarked that with a lot of other local authorities, including Rotherham, and they do a very similar thing. So we will lose, I think I worked it out, about 16% of that 6,000 hours will be lost just by moving that across to other provision. The 3,000 hours of that time is really going to be focused on the reviews that was referred to earlier by Ryan, and that rise during the pandemic, where we're currently reviewing those packages to bring them back in line. So there'll be a lot of work put into that. And the final piece is the 2,000 hours, which is really about the new practice standards that we've got in adult social care, where we're going to introduce that strength-based approach to assessment reviews, but also supported with that strength-based approach from the providers as part of the new provision. And the trusted reviewer will be a key part of that model when it goes live next year, because it will maintain those hours and keep them down.
Thank you. I have two hopefully quick questions. One is about how do we reassure those people that have responded to the survey that are worried about the new system not being flexible enough, when people don't need the same kind of hours all the time, and it may change from week to week. And the other question is about are we looking at what impact potentially long COVID could have on service requirements in terms of adult social care, and how we would support people with long-lasting long COVID symptoms.
Yeah. Thank you, Angela. Yes, we are, with part of our communication plan aimed at people in receipt of care and their family and carers, there will be a communication plan that will be about changing that culture around moving from paying on what you actually get to paying on what was planned, because it is designed to be more flexible and responsive for people. That one example I tend to use is if you're working on plans, so for that 7-day period, if a person decides that she doesn't want a shower on one particular visit on a Tuesday, but wants it on a Thursday, that's about being flexible and responsive, and it's trying to do that in that manner. But there are going to be challenges around that cultural change with people in receipt of care to reassure them, and we will be dealing with that as part of the actual communications plan. As for long COVID, we work very closely, as you can imagine, with the health system, and we're in regular contact with Sheffield CCG and SDH, and we have surveillance around the impacts of long COVID, and that really is kind of work in progress, and see what will materialise. So we are aware that that might have an impact in demand going forward. Thank you.
Thank you. I am going to ask for people approval of the recommendations in this report. Are there any kind of disagreements with that, or are we happy to approve? Yes, thank you very much. Great, thank you, Paul and Catherine. And we are moving on to item 10 on the agenda, that is about commissioning and procurement of temporary care home beds. It's on page 71 of the agenda, and Joanna, Louisa King and Janet Kerr, I believe, are presenting this? Oh, is it Catherine? Thank you.
Yeah, thank you. Sorry, it's me again with this one. So this is another report asking for approval for the recommissioning and procurement of temporary beds, somewhere to assess, respite and emergency beds. It's a service that we have to deliver, and we've done some reviews, and this report sets out what we want to do in the medium term to make sure we can continue to fulfil our legal requirements, to do it in a better way than we're doing it currently, both for people's outcomes and the flow across services, and also having a positive impact on some of the voids that we experience at the moment, with a longer term aim that we'll be working closely with the CCG to further integrate and do joint commissioning around our temporary beds.
Are there any queries, questions, comments from members? So what this report is asking, what the officers are asking us to do is approve the commissioning and procurement of the contracts detailed in the report, noting the budget provision, and also delegate authority to Director of Adult Health and Social Care in consultation with the Director of Legal Governance Services and Director of Finance, to approve the procurement strategy, conduct the procurement and award resulting contracts. Are we happy with that? See, committees, cross-party work beforehand, magic.
Thank you.
Okay, thank you, Catherine. And we're moving to item 11. So item 11 is Adult Health and Social Care Strategy Delivery Plan. It's on page 139 of the agenda. Presenting should be John Brenner. Are you on your own? Alexis, I suppose, will support you if needed. Thank you, John.
Thank you, Chair. So my name is John Brenner. I am the Principal Programme Manager. I lead the Change Programme as part of Alexis's leadership team. Today in front of you, we've got a strategy delivery plan. This is a follow-up to the strategy, the Adult Health and Social Care Strategy. It was that just before the election was agreed at the Cabinet after 18 months' worth of co-production, including comments from councillors across the system, voluntary sector partners, members of the public, workers across the system, and of course about a third of those comments came from and input came from people receiving care and their family carers. So a long piece of work and something that I think helped set the direction for the coming years. So that resulted in a strategy, living the life you want to live. In that strategy, we made 6 commitments. Supporting people, we are going to support people to live a fulfilling life at home, connected to the community and resources around them, and provide care and support where needed. Secondly, provide temporary assistance to help people regain some stability and control in their life following ill health or crisis. Thirdly, provide care and support with accommodation where it is needed in a safe, supportive environment that can be called home. Fourthly, make sure support is led by what matters to you, with helpful information and easier to understand steps. Fifthly, recognise and value unpaid carers and the social care workforce and the contribution they make to our city. And sixthly and lastly, make sure there is a good choice of affordable care and support available with a focus on people's experiences and improving quality. Now, those are quite high-level commitments. It talks about what we mean by them a bit more in the strategy itself, but we wanted to bring forward to the first meeting of the committee the delivery plan for that strategy. So what that means in practice, what the flavour of our major activity is over the coming years, to give you a chance to comment and influence and steer that work in the years ahead. So that is the paper in front of you. This is a living document, but it is a reflection of the current programme plans, the current plans that we are making to deliver upon that strategy and all of our aspirations for the people of the city. I won't go through the detail, you'll be relieved to see, to know to all of the detail, but what it does pull out is all the major pieces of activity we're planning to deliver the changes that we want to see to deliver this strategy, and some of which you've just agreed through the home care report, but there are many elements of this over a multi-year programme. The document itself is closely linked to not just the outcomes of people that we want to support them achieve in terms of their lives, but also our statutory responsibilities and the quality of care we provide, and we are statutorily responsible to provide, and our budget plan, so linking those three threads together. The last thing I want to say is just to thanks to a couple of officers that have done significant work on this. Charlotte Murray, who led the work on the strategy itself and delivery plan. Nick Rust has worked very closely with us and pulled together the strategy delivery plan itself. There's a lot of detail in the plan and behind the plans. We're happy to take questions now or take questions away if there are detailed questions and provide more information after this. But this, I think, gives you a flavour of or the summary of our strategic plans over the coming months and years. I think that's probably all I want to say, Chair, but obviously I and potentially Alexis and other officers are happy to answer questions on the contents.
Councillor Linders.
Thank you, John, for this. I think it sets out what was included in the strategy in a clear way and breaks it down, in my view, appropriately. I think it's not probably as much a question for you as just something to think through the committee. I mean, one thing I'd say that clearly many of the things that are both in what we're delivering now and future deliveries are very linked to what's in our work programme for the committee. So we need to work out ways that this sits alongside that process really well, because ultimately, if it's other than things that are clearly outside the scope of the strategy, anything in our work programme which is within scope of the strategy needs to be clearly linked to a strategy outcome, because we've got the strategy, you know, it's our council document, so we need to work to that. I think the other thing I'd really ask is that at the moment, the current delivery time frames, things we're doing now, are sort of April, I think probably earliest is probably to March next year. If we're going to successfully work out, you know, how well we're doing here, we need to start to work out how we can monitor which of these are on track, which aren't. Some of them weren't going to be clear about that for a little while, just because of the way they are. So I just think we need for the committee to find a cohesive way of monitoring that process in a way that works with ensuring the work plan is up to date and very linked in with this, and also the committee is really well cited on which of these areas are dropping. I mean, that's taken as read for me because I was more involved in the development. This is, you know, where we want to be. Obviously, if the committee feel that some areas need more focus than others, then that's for us to decide. But I think we do need to, as good a document as it is, we do need to find a way to link it further into the work plan and to monitor its progress more as time goes on. I admit we're not quite at the time where monitoring progress is fair, but it may well be into, say, the autumn. Thank you.
Thank you. Can I just add to that? I totally agree with George on this. Maybe it would be, I'm assuming we're going to have like a kind of a tracker where we can, which is the normal kind of process, and hopefully we can share it with all the members of the committee, but I'll let you answer.
Thank you. So the recommendation is that you ask for 6 monthly update reports and refreshes of the plan. That will, as time goes on, that will both give you updates on the actions and our progress against the actions which Councillor Hammond is asking for, but I think equally as important from hearing you speak as councillors is the impact that will have. So we're doing quite significant work on a new performance framework and outcome framework, and we'd want to be reporting the outcomes they're having, not just the actions and progress and tasks that we are completing and contracts we're putting in place, etc. So absolutely. In terms of the work programme, as part of the proposed work programme that that Alexis and the rest of us put forward, we looked at the strategy delivery plan and tried to pick out the key things to inform the work programme, but obviously as your priorities develop and through the life of the committee, the work programme, the delivery plan will need to change to reflect that, and obviously you will give us a steer on what you want to see through the work programme, which of course we will listen to.
Thank you. Councillor Phipps?
Thank you, Chair, and thank you for the report. It's good to see. I agree with both of the co-chairs' comments. Thinking about monitoring and just kind of feedback in general, and this might be more of a question to the chair, if that's okay. Do you think, is it possible to have Healthwatch sitting on the committee as a non-voting member, just because I think they'd have interesting feedback, like they do in health scrutiny, in these meetings on the items we're discussing, set to discuss, just because I know we can get reports from them, or they could sit and answer for specific topics, but generally I think they'd have useful feedback throughout. Sorry, that's a bit random.
I would be happy with that if we can agree amongst the members. Councillor Lee, did you want to add something to that?
There's an ongoing governance review that's sitting and going to be reviewing all the arrangements and all the work that the committees are doing, and we'll report, I think, in 6 months, but maybe that should be where that should go, rather than just making a decision now, randomly.
Yeah, I'm without wanting to delay things, I'm keen to not make that decision right here, right now, because I do think that as much as a huge amount of time Healthwatch, I've worked with them closely on a number of things, I'm not sure of the position we are as a council in co-opted and non-co-opted members of committees, and I think as a committee member we should all be cited on what other committees are doing, so we can have a common approach, and consistent approach across committee to that. However, I'm more than happy to take that up, to say as chairs, we'll take that up and look at what we can do to involve Healthwatch and potentially other organisations in the work of our committee.
Yeah, I can sort of see both sides of the kind of argument, and I think maybe if we just have, like, in one of our briefings, George and Steve, we can discuss it together and see how to move forward. I think from a legal point of view, Sarah, could you give us a bit of a direction?
Yes, Chair, thank you. It is possible for committees to co-opt members, but obviously that's something the committee would have to consider. I believe there is a proposal that Healthwatch be co-opted to the Scrutiny Committee, the Health Scrutiny Committee, which is a subcommittee of this committee. There's a report going explaining to that committee that proposal, so a similar arrangement could be made for this committee, but that isn't a decision that you have to take today, and actually in terms of formally co-opting them, I would suggest that you have a report explaining your options before you make that final decision.
Would members be happy if we sort of consult for the next few weeks or whatever, and then we have it coming back in September as if we agree that that's what we want? Is that okay with you, Councillor Phipps? Other people happy? Great. Thank you. No further questions? Thank you. Oh, Councillor Nelson, sorry.
Thank you, Chair, yes. Thanks for the report, very clear, but I have got questions about the word health throughout the report, and the fact that the word health comes and goes throughout this report. So the recommendations refer to the Adult Health and Social Policy Care Committee approving the Adult Health and Social Care Strategy Delivery Plan. Elsewhere, that word health is missing, and I'm just quite intrigued by that. Point 3.3.2 on page 145 does say about working closely with health partners. I mean, this is clearly a more social care orientated plan, really, but health is there in the title, and we have got this point which to me wants some unpacking about the working closely with health partners. Where does health sit in this strategy, and how is the integration going to work closely together?
Thank you, Councillor Nelson. So in terms of the wording, the strategy is the Adult Health and Social Care Strategy. Alexis's job title and the scheme of delegation of the Council is the Adult Health and Social, the Director of Adult Health and Social Care. And the reason we have differentiated the citywide Adult Social Care Strategy with the specific actions taken by Alexis and her delegates in that role. So that I agree the language is a bit confusing, but that is the reasoning behind the differential in the report. But actually I think you're right about needing to unpack that a bit. What that means in practice is that the delivery plan is the responsibility for delivery of the Director of Adult Health and Social Care and us as her leadership team and all the many skilled staff that work with us in partnership with others, but we are taking responsibility for moving that forward. We are working very, very closely, though, with health colleagues, and there are, and you know, as members of this committee will be well aware, there is all kinds of interaction with health colleagues, so that can range from, on an individual level, people often have one or more health conditions that are in the adult health or social care, so actually in terms of helping the public sector wrap our care around, we are exploring close ways of working in the most appropriate way, and that feeds into all kinds of elements of the redesigning of our operating model, for instance, how we work closely with GPs and primary care networks around citywide specialist teams, etc. And we'll talk a bit more about that as a future item for this committee, although we're happy to brief members whenever you want about it, but there'll be more detail coming through on that. And then beyond the individual level, there are, I mean, it layers up from very close cooperation on an individual organisational basis, so working very closely with the teaching hospitals around hospital discharge, around mental health teams, joint mental health teams across the city, where we are trying to coherently work in good bilateral ways, that as part of a coherent system, and that layers up into the wider Joint Commissioning Committee and Health and Care Partnership, which brings together multiple stakeholders across the Health and Social Care Committee in terms of designing a system that works as a whole, which, you know, like all areas, we are on a journey with. I think the last thing I'd like to say in the context of the strategy in response to this is that there is a very clear link and an overt link between the health and wellbeing board outcomes that have been designed by the Health and Wellbeing Board as a statutorily required agency, body, which has council representatives on, and these being part of that overall health and wellbeing outcomes we want to achieve. And of course, you know, this is the reason why we all do this, is achieving those outcomes for individuals. That's a very quick run through. It might be that in briefings outside this, we want to unpack this, or you want to bring back further conversations about how the health and social care system works as a whole, and you will have professional and counsellor expertise on this that you may want to feed in. But I think that's a very quick answer and summary from quite a complex issue. I hope that explains at least the wording rationale and what we've aimed to pull out through this report. I don't know if Alexis has anything you want to add to that, or you're happy with that response?
No, thanks ever so much. I think a briefing might be helpful, Chair. Could we bring that forward at some point to understand more about, as we're moving into a more the formal integrated care system as well, to understand a bit more about how the integration works?
Yes, yeah, surely, yeah, especially after the 1st of July, we want to really, so shall we try to timetable a briefing for all members of the committee rather than just the three groups represented by one person? Is that what you are asking for, Councillor Nielsen? Is that okay with everybody? Okay, so we'll timetable one in this side of the summer rather than after, so that people know what they're doing. Am I correct in saying that the word health here is used not just healthcare, but it's health and well-being? It's like the whole person, isn't it?
Absolutely, yes, Councillor Argentia.
Great. So the recommendations is to approve the Adult and Social Care Strategy Delivery Plan. Requested the Director of Adult Health and Social Care comes and gives us an update every 6 months in the committee, but I assume we'll get more updates between the meetings, and request the Director of Adult Health and Social Care reviews and refreshes the plan on a biannual basis for the consideration of the committee. Is everybody happy to approve those? Brilliant. Thank you, John. And thank you, everybody, because we are doing amazingly in terms of time. I was so worried. I'd put times of when we start and when we finish each item. So thank you, everybody, for doing your homework beforehand, which means we're a lot faster than I thought we would be. And we are moving on to item 12, which is Adult Social Care Financial Update and Progress with Financial Recovery Plan. And presenting is Nick and Alexis. Thank you.
Hi everyone, thank you, Chair. The name's Liam, actually it's Liam Duggan.
Apologies, Liam.
No problem.
I have the wrong names on my list.
No problem. So my name's Liam Duggan. I'm an Assistant Director for Governance and Financial Inclusion in the Adult Health and Social Care Service. And the first paper I'd like to discuss with you is the financial update and progress with financial recovery plan. The purpose of this report then is to provide an update on the adult social care financial position, and provide an overview of the budget and of the recovery plans. We've done a lot of work on governance over the last 12 months, and one of the pieces of that work is a conclusion that a full budget analysis each year is something that would help with transparency and visibility of known risks. So this report is looking at the whole of the budget, highlighting relative growth in spend and links with funding streams, as opposed to our traditional reports, which tend to look at variance month on month. The paper starts with an overview of adult social care income, and we can see the gross budget there for adult social care at £274 million. Just under half of that is funded by Sheffield City Council cash limit budget, with the remainder funded from grants and other income. Of course, adult social care being a means tested service, there's income from people who use services also included in that income as well. I've made reference to some national reforms that are heading our way in section 3.10. There was an announcement last September by the government of £5.4 billion worth of money over 3 years for adult social care reform. So just trying to give a little bit of an indication about how that plays into our budget. 3.6 million of that was to pay for the new lifetime cap on care costs and the fair cost of care, which was referenced earlier by Ryan and others. There was a further £1.7 billion nationally to improve social care in England. That investment being backed up by the new health and social care levy, which people will have heard of. I think the main piece to say about both of these items is that the cost to the City Council, as Ryan said earlier, the cost to the City Council for both of these reforms is not yet fully understood, and certainly the income that would come to Sheffield specifically from that national pot is far from certain. The other piece on funding is just to reference the funding that came in as a result of COVID, and which ended at the end of March last year. Two significant pieces there. The first being enhanced hospital discharge funding, and we'll see shortly £13 million worth of income into the City Council to support hospital discharge during the pandemic period. That funding has ended. Sadly, the support being provided has not necessarily ended, and that contributes to a large part of the funding challenges that we're now facing this year. And the Council also administered a sizable number of one-off grants, much of which was passported to independent sector providers for workforce and infection control. Some details of that in the report too. So a little bit more onto the allocation of that £274 million gross budget. We can see that most of that is funding third-party spend in adult social care. The table in 4.3 shows that the biggest group of recipients in adult social care in terms of cost are older people, primarily through residential and nursing care and home support. There's also a significant number in learning disability, with the greatest amount of funding going through through supported living support and direct payments. A breakdown in table 4.5 shows by group the way each of those budgets is funded by contributions from individuals, from health, and from other contributions from grant. And then we're into our current forecast for 22-23. We've heard already that we're not currently forecasting to deliver to our budget. Table F shows where we're at with that budget and the £11.6 million forecast overspend as per Ryan's report earlier, with this providing a little bit more detail. The thing to pick out of Table F, I think, is the enhanced hospital discharge funding that's got a little asterisk by it. We can see there's the £13 million worth of one-off funding that's dropped out this year. Had it not been for that one-off enhanced hospital discharge funding, which reduced the overspend to 10 million in 21-22, the cost of care and support would have exceeded planned budget by around £21 million. Table G describes how our budget for this year was arrived at. We can see the £21.8 million forecast overspend that we're making last autumn for last year's costs, together with additional cost pressures that we're anticipating for this year. So we're looking at £43.2 million worth of pressure going into this year. Of that £43.2 million, as Ryan mentioned earlier, one-off reserves has been used, social care precept, and increased adult social care grant from the government, with £25 million worth of savings or pressure mitigations built into the budget in order to balance the rest. The forecast overspend, as we've heard, reflects largely the forecast non-delivery of around £9 million of those £25 million worth of savings that we've gone into the year committed to. And due to that, a range of actions are underway to establish a balanced budget, and they're set out in section 6. In 6.2, table H, I've provided a summary of the £25 million worth of savings that we're committed to. This is not the full list, but it's broken down by category, and we can see that the most significant in terms of values is around reviewing excess costs. The reason for the overspend last year was largely because of COVID, increased costs, increased support to keep people at home and for infection prevention. So our focus for the budget has to be on conversations with those people with very high cost support and people whose support saw a significant increase during the pandemic, to consider whether those packages can return to closer to pre-pandemic levels now that the pandemic emergency period has finished. We can see that there's a significant financial benefit arising from the work that is underway. The conversations are delivering reductions to care, and we are seeing that less care is needed than was put in place during the pandemic, as we would expect, but there is more work to do to get us to the budget target. Also, mitigating new costs has significant value in terms of because of the turnover that we see in adult social care, we need to also be focused on the size of new packages coming through. To date, we've delivered around £6.2 million worth of savings so far, and as I've said, by the year end, we're forecasting delivery of 16 million. A range of lines of inquiry are underway to improve the forecast, narrow the gap, and deliver the budget on target. As you would imagine, the emphasis of that work is on the reviews, is on prioritising capacity for the delivery of those reviews, and getting people seen early and having the right conversations at the right time. There are also a number of other avenues that we're exploring, including close working with NHS colleagues to ensure we're making best use of our shared capacity. We're looking at whether there is opportunities for levering in additional funding into adult social care. We are partway through an independent review sponsored by the LGA to going through all of our budgets and proposals to see if there's something we've missed, opportunities that there might be there for further reductions, efficiencies. We are embedding practice standards, governance. We are improving controls and peer review. And we're looking at the Sheffield Discharge model to see if there are opportunities there. Finally, I think we're proposing that a members' task and finish group, or a group between members and officers, consider next steps. So I'll close it there.
If I just may add, Chair, a couple of points in terms of recommendations based on further advice over the last week. We just want to kind of know, and first of all, just want to thank Liam and the team for all the work that's went behind the budget. Just I think it's really helpful to note here, there's been an incredible amount of work done over the last year to really understand the adult social care budget. And I think it's really helpful to note the amount of time and effort that has went into this by officers, both within adult social care, but also across colleagues in finance and commercial services and legal services, to be able to set this very comprehensive overview of the budget and adult social care in a very transparent and accountable way, which is our direction of travel and going forward. In terms of recommendations, what we are asking very much is to note the report, to note the impact of one-off funding, and to note that is no longer available to fund adult social care and going forward. That obviously has the implication in terms of the budget pressures that we have, because we continue to have demand without the funding to go with it. And I think it's really helpful, so I'm asking that to be noted, but equally to agree that there is a regular report provided by officers of adult social care regarding their update on the budget position, and particularly delivery upon the recovery plan progress, which comes back to Mary Lee's earlier point about we are continuing to go and relook at how we undertake our activities so that we could forecast to be in a better position come and deliver a balanced budget. So that's the reason and context for that recommendation. So very much read my mind earlier on was the context of that one. And then the fourth recommendation, suggesting that we withdraw that recommendation based on some further advice received, and replace that with a recommendation that officers work with members to both provide a further overview and detailed overview of the budget, and that secondly that we come back with further suggestions for spend priorities based on a further review of the budget and going forward, aligned with Ryan's recommendation earlier on.
Thank you. Councillor Lee.
Thank you. Yeah, it's a very difficult situation, and I know everybody's working really hard to try and get through this. But I'm just wondering about you've got a citizen panel, and you've got various user groups and service user groups, so you consult all sorts of people across the city that are associated with receiving care or maybe carers. Do they understand the situation that the council is in regards to the budget? They're fully familiar with that, and the savings we have to make, and that savings that not made now will be savings we have to make further down the line.
I think people really get it. I mean, certainly we speak to individuals and to partners. People get the situation that we have got with an adult social care. And I think, you know, it's not only in terms of our conversations, but I think it's been well publicised. And both ADAS have been very helpful at proactively highlighting the pressures on councils across the delivery of social care. And so certainly in our conversations, people understand it, and equally our partners in health understand this, which is why in part of our recommendations, we're taking a really integrated approach with health to look at how do we look at our budgets together, and actually how do we get the best efficiencies together and going forward to focus around a shared focus on outcomes. And that's been absolutely my key perspective. And coming from a very different system of working, that to me is how you achieve better outcomes, but within the resources that you have available to you. And it comes back to your point, Ellen, about the wider briefings to members as we come into this new system, about how it becomes a very kind of practical focus. That's the reason why I thought I'll wait to this question here, because I thought this will inevitably come up. But we have, so I think people are well aware of it. I think the issue is that ultimately the crux of it is that, that we have the same pressures as NHS have in adult social care, but the funding is not the same. And that really is the crux of the matter in terms of the budget. And that's detailed within this report about the different income and funding streams. And often very much on a day-to-day basis, I'm asked as a director, what funding do you have available? To which I have to always answer is none. And that really is the crux, and that is really the challenge that we have. And we have this graph that I often have to everybody, is that the demand is going up in terms of adult social care demand is going up. But ultimately, the resources going in the opposite direction. And the challenge that we're trying to meet very simply in terms of what we're trying to do is meet that gap between demand and resource. And there's a really fantastic report that's been set out by a range of different audit bodies who set out very, very simply, and which I can share with members as I do further briefings out with, to explain some of that wider context. So the answer is yes, people are aware of it. I think the reason why we have had such good engagement with the delivery plan and, you know, re-empowering our leadership team across adult social care to lead and work with colleagues is because people get our challenge and they want to work with us collaboratively to find solutions and find a way forward, because ultimately the more that we do in collaboration, we'll get the best outcomes for people. That's the crux of it. So a very long answer to a straight question, but it is a very complicated subject. It's probably one of my most favourite subjects at the moment.
Thank you. Councillor Lindis Hammond.
Thank you, Liam, for that comprehensive useful report. I think it's always useful to see, before we get into any of the, you know, the difficulties this year, you know, the budgets and challenges set out in a very clear and simple way, so it's really appreciated. Thank you, and I also, thanks to both of you, I think it's right that, you know, I'm glad that Recommendation 4 has been amended, because I think it's right that the committee has time to discuss task force groups ourselves, and I'm sure that, you know, the financial challenge of the committee will absolutely form part of whatever task force group we decide on. But I'm glad of that alternative approach on this particular thing. I just want to ask a question, really, and again, it's a question that could have been asked to Ryan, I guess, earlier, but there are some overlaps here around. So we have around £50 million that comes in from fees and charges from those that receive care in the city, and yet we know at the moment people are facing and are likely to continue to face an unprecedented cost of living crisis. I suppose it's a kind of double-sided coin, really. Firstly, what risks do we see in terms of whether we will simply receive all of that money, being that we are, as an organisation, we are and should be sensitive in the way we collect money from people, and we've always said in adult social care, you only pay what you can afford, and that absolutely has to be the principle. But secondly, how can adult social care contribute to the, I think the task and finish group going on at the moment, council-wide, contribute knowledge and ideas and solutions to the council's approach to tackle the cost of living crisis, because it is evident to me that many of the city's most vulnerable people do receive our services, and we are probably in contact with vulnerable people, and social workers or care workers are in contact with people more than perhaps more regularly than many other parts of the council. Thank you.
So I'll answer first, and I'm going to hand over to Liam, who really does know the detail behind this. The first bit I'm going to respond to, is the final bit, is around the cost of living crisis. We've actually got that as a clear delivery function within the delivery plan. For exactly that point, George, is I 100% agree with you, is that we have a really difficult situation for individuals across the city and across England and across the UK with the current situation. And what we've done is make a commitment to look at our own services, to how can we work not only across the council, but actually look at what we are doing in terms of some of our account services to develop what I would call as like a welfare rights services and work in partnership with colleagues across the VCSE to do that. Because often when I speak to individuals and parent carers and family members and individuals with experience, often it's the most practical support that we could give in terms of giving advice about income, about benefits, about maximising income. That's the kind of practical advice that people want to have, but also that practical advice about navigating through sometimes quite a complicated benefit system. And that's often what we see, very much on our day-to-day basis. So actually one of the key ambitions that we've got within our delivery plan is to work and co-produce a different way of modelling going forward that's very practical from the point of view of individuals. And this has came up so many different times I've spoke to people. So I do think that's one of my kind of really practical ways of approaching the same problem. But equally, in terms of the cost of living crisis, we're absolutely being connected into the council-wide approach to this, because for me, that is core and centre to social care and social work. Social work is about social justice. And that's what I stand for as a Director of Adult Social Care. It's about social justice and about improving inequalities, but also to ensure that people are not made more unequal by the situation that we have. So absolutely, that's a commitment that we have to go forward. So I'm really delighted you brought that, George. And what I'm going to do is hand over to Liam to give the detail around the trees in charge, and who's got absolutely lined up.
Yes, thanks, George. So the first thing I'd want to say is that if there is anybody out there who is struggling to pay the contributions, then the message to them is that we want to hear from them. We don't want people to suffer in silence. We need people to be making contact with us. We've got a team in the council that is dedicated to the support of people who are in financial difficulty or struggling to pay their bills, and there are things that we can do. So that's the first thing. Second thing is we are starting to see more people who are struggling to pay. We are getting more incoming calls from people unable to pay their invoices, and so it's something that we're certainly feeling in adult social care. It's something that we're responding to kind of immediately in terms of actually having a little bit more capacity in that team to be able to support people and have those conversations. What we've done in the policy, the key part of the Fairer Contributions policy, which makes reference to the amount of money that people have for living costs, is the cost of living allowance, and nationally that had been frozen up until this April for a number of years, 5 or 6 years, and our policy was linked to the national rate. So a decision was made to increase our cost of living allowance, to separate ourselves from the national framework and to increase our allowance in Sheffield last year by inflation. And so we've now got a policy that makes a commitment that the cost of living allowance will increase with inflation each year, irrespective of whether the government increases its statutory amount. So that's the first thing that we've done. I think that's absolutely the right thing to do. The government has this year increased its statutory amount, but we've increased it with inflation, and therefore we've maintained that headroom that people have for cost of living above the national statutory amount. The second thing to say is that where there is particularly pressure on fuel allowance, on fuel cost in year, then again there is scope for us to work with people to review their heating costs, their fuel costs, and ensure that our allowances are keeping pace with their costs, particularly if their costs are higher than we would expect. But of course, the other pieces that we've put in place over the last couple of years is a dedicated social worker in adult social care that works with people around the financial aspects. So that person supporting particularly people with complex needs, with financial difficulties, ensuring that they're getting access to the support that they need. We have a complex debt panel that's been set up to bring together social workers with other agents, including debt recovery colleagues and legal colleagues, to ensure that we're providing the right advice and the best possible support we can to people who are finding themselves in a large amount of debt, potentially owing debt to different parts of the council. And we've also established in the last couple of years a direct arrangement with the Citizens Advice Bureau to provide benefits advice to make sure that we are optimising support for everybody. In this year's budget, we've fast-tracked arrangements for reviewing every single person's support to ensure that financial assessments are kept up to date and that people are accessing the benefits they need. And what we've found is that there's a significant number of people who are not accessing or optimising their benefit entitlement, and we've been able to support a lot of people through that. And with the new arrangements, additional capacity to fast track that will be getting through everybody by the end of this financial year. Finally, important to say that whatever we do in adult social care, through the charging policy particularly, we are only able to support people who have to make a contribution to their care, and those people are by definition those people that not including those people with the least amount of money. So those people who have the least don't pay for their care, and so that's the importance of us working with other agencies and across the council to support the population at large, not just those who make a contribution towards their care costs.
I've got Councillor Harris and then Councillor, sorry, I've forgotten your surname, Woolhouse.
Thank you, Chair. It's reassuring that Liam's, what you've just said about ensuring, because it relates to the question asked on the previous report, and that is reassuring. My question was on, forgive me because I wasn't part of the final discussions on the changes to the recommendations. It's my fault, but I do think that it's very important that we as elected members, the policy committee is kept abreast of the challenges throughout over the course of because that was in the recommendation to the month one report, that we need to be cited on the state of play by September, by our next meeting. I wasn't quite clear on so I was a bit hesitant when the suggestion was to withdraw the task and finish group for that reason. But I'm not quite sure. I just need to be reassured on what the wording of the recommendation, how we actually ensure that members are abreast of, the financial, the financial recovery plan by September, because it is an ask that we have to address, isn't it?
Can I add something myself? Because I was going to ask around the same thing. I was going to ask whether we could deal with it like informally but efficiently by having regular briefings and timetable them for the summer, taking into account where at least the spoke people are in the next couple of months, and so that we have something ready there is a SNR on the 30th of August, and then our meeting is towards the end of September. So if we could just timetable some meetings so that we know that we can, you know, have sight of things, but also probably, you know, push for some decisions. Thank you.
So yeah, so in terms of the recommendations, so recommendation number 3 is to provide a formal report on the update to the budget position to each committee, so that there is a formal, very much just like this, so that the members are absolutely appraised as our progress in a very transparent and open way, which is what I think is extremely important. Then in terms of the 4th recommendation is exactly that, is that we provide briefings to members in between now and the next committee into the and as the budget position, but that we also work with members to ultimately to agree a position where we could come to a balanced budget by 2023. That makes sense.
Can you just come back? And sorry.
Sorry, Councillor. I was just going to say the note that I made, and Alexis can correct me if I'm misinterpreting what she said. I believe the suggestion is that officers would like to change recommendation 4, so that instead of saying agree that a member's task and finish group is implemented, and then the rest of that recommendation, that it then instead says agree that officers work with members, and then continues to consider priorities for spend, to give the committee more flexibility in how it does that work with officers. That was what I think was the proposal. Thank you.
I guess, and you can respond to this. We you know, should there be a major, you know, issue, that we have the fallback of calling an urgency committee. Is that correct?
If I may, Chair.
Yes, please.
Yes, that's right. So the 2 options. Officers could request an urgency committee because there's a particular report, an urgency subcommittee because there's a particular report that they wish to put in front of the committee and it cannot wait to the next scheduled meeting. The other option is there are provisions in the Constitution for the calling of extraordinary meetings of the whole committee. So those would both be options in that situation.
Okay. In that case, I think I'm happy with that.
Thanks, Alexis. And Sarah, is Councillor Woolhouse.
It was just going back to the about people paying their bills or invoices. How soon are you notified if people aren't paying them? Is it, you know, are they fairly up to date in notifying you, or do people get into quite a state before you are informed?
It depends. It's variable. Some people. So what we try to do is. With our accounts team, the outgoing calls is critical, and that's the prevention bit, making sure that we are getting, when the first invoice lands or when the first invoice is not paid, that's really a critical time for us to try and make contact with the person and to see what the reason is, so that we can have a conversation before that person's position might deteriorate, they get to more debt or crisis or what have you. So our aspiration is the outgoing call and making contact at the right time. That's a challenge depending on the number of incoming calls that are coming in. And that's why we're looking to put more capacity into this in order that we're better able to make those outgoing calls. Some people will make contact with us, some people will notify us, other people will not. But I would urge anybody who is in difficulty or anybody who's supporting somebody who's in difficulty, please to make contact with us, because if we know about it, then there's something that then we're better able to deal with it and support that person.
Thank you.
Thank you. Before I pass to Councillor Milson, how do people get in touch with you to let them know that they are in difficulty? Is there anything in the correspondence that says if you're struggling, ring this number or email this number?
Yeah, we send invoices on a monthly basis, and the invoices have got those details on them.
Thank you. Councillor Milson.
Thank you, Chair. Just noting in Appendix 1 with some interest that the adult health and social care services are directed, there's two little bullet points there that I'm really keen on, directed to promote well-being and directed to prevent the need for care and support. And I'm just thinking about what value is currently attributed to the well-being contribution brought by the voluntary and faith sector and possibly local area committees as well, and the work that they can promote and support. And is there scope to look for ways to support expansion in that field as to what they can bring in terms of sustained well-being and therefore playing their maximum part in keeping people well and taking pressure off social care and mental health?
Going to that, it's a really excellent question, Ruth. And we have one of the key for me is exactly around that is that the Care Act and the legislation that is a backdrop to adult social care very much is focused around the well-being and ultimately the focus on prevention. Actually, it's one of the Director of Adult Social Care, our statutory duties is to promote prevention and well-being. And so for me, as part of our delivery plan that we spoke about earlier on, and actually the care governance framework, which is coming next, the key focus for me is around about how do we work with colleagues in the voluntary sector and colleagues in, across health and across housing and equally with individuals and family members who often know best themselves and communities to go and look at how we support well-being and the prevention of the need for care and support in a different way. And that's absolutely route to the delivery plan going forward. Because ultimately it comes back to something that Martin said earlier on, is that if we, in a sense, stop focusing on that, all we'll end up having is a crisis-driven adult social care services, which to some degree is the reason why we've ended up in the financial position that we've ended up, to be honest. And so that's where the focus is absolutely important going forward.
May I come back, Chair, on that? So I'm really intrigued to know to what extent we know, to what extent we can put a value on social prescribing and the input of the voluntary sector at the moment. Is it possible to put a value on that and therefore look at how to expand on it?
So it's lovely you asked that question, because actually over the last 2 days that is something that I've been actually looking at with some colleagues, is about how to reimagine care. And for colleagues that have been part of that discussion, that was one of the questions that I'm really interested in, how to put a value, because at the moment it's very hard to put an accounting value, for want of a better word, onto to well-being and to prevention. So that is one of the commitments that I've made, to go and seek some support from some other bodies who actually kind of help to look at these issues, to look at how do we actually put, for want of a better word, a number and a social value number to what we're doing around wellbeing and social prescribing and prevention. And my offer, and hopefully for colleagues that listen out there in the voluntary sector, is to do this in collaboration with colleagues in the voluntary sector, because I do think that this is something which is really important going forward, because in a sense this budget report sets out your GDP value in terms of social care, in terms of the financial accounts that we have, but actually what you're talking about is the social value, and which I think is absolutely core to social care and going forward, and which to me is the essence of the legislation in which we work to, and for me is the reason why I came into social work many years ago. And so yeah, I think it's a really excellent question, and you have my full support and commitment to making that a reality.
Thank you. I'm going to bring that to a close because we have another item on the agenda. So are we happy to accept and approve the recommendations, including the fourth one that has been amended? So there is no mention of the task and finish group, but there'll be a less formal. People happy with that? Real? Easy? Thank you so much for all the work, and more to come in the next few weeks. So, last item on the agenda is item 13, Adult Health and Social Care Governance Strategy Performance Improvement Framework and Quality Improvement Plan. And Liam, are you presenting this for us?
I think we're going to share that, Chair.
I'm going to say a few words and then I'm going to hand over to Liam. So that ultimately, when over the last 15, 16 months, is when, as we did with listening exercise to individuals across Sheffield and with partners and carers, is what became really, really important for me is that not only do we focus on the delivery of the actions that people were talking about, but we set an approach, a set of principles, and how we start to get to the point of really good quality care in the city, but also high-performing services. But fundamentally, we have a set of outcome statements in which we are measuring the impact of what we do. And it very much comes back down to the question we just discussed, is that it's lovely to talk about actions and have a red rag rating, but actually, what's the impact of all that on people? So what we approached this was said, let's try and create, for the first time in adult social care in the city, is a governance framework which sets out a set of principles, which is about, first of all, that we will take an approach that's based on listening and engagement to individuals, but equally we'll focus on the doing, which is the part that we focused on through this. But equally, that focus on principle and openness and transparency and accountability, and bringing that accountability to adult social care in the city in terms of our performance and our quality and how we go about how we're taking this forward. And I would say that Liam and the team and all the officers in my team have spent a huge amount of work in trying to marry up what's in our strategy, what's been within the what's coming in terms of the New Care Quality Commission inspection regime that will come to adult social care, as well as the focus on keeping true to our principles, which is that we continue to have this focus on engagement, and very much that we continue to go and develop this as we go forward. And what I would say is I see the strategy and the framework as the start of a conversation. It's not the end of a conversation. It's the start of a conversation about how we define an approach to very much putting people at the centre of all that we do, to ensuring that we are founded on principles of listening engagement, and that we'll continue to embed and further our approach around listening engagement, and very much in collaboration with colleagues such as Healthwatch and with members and with the public and with citizens who we work with, and equally having that focus very much on openness and transparency about our performance and the good with the bad as we go forward. And I think the only way in which we could get to what we all want to get to is accessible, high-performing, excellent quality social care services in the city, is to have that very much that governance approach which is behind all this. And that really is the crux of the paper. So at that point in time, I just want to hand over to Liam. You can say that one.
Thanks, Alexis. So, yeah, this paper then is to provide an update on the progress with the development of our governance framework, as Alexis just said, with particular focus on the two documents that are the appendices. The first one is our care governance strategy, which describes the overarching framework that we are proposing. Not yet a fully populated framework, as Alexis has mentioned, but our proposed framework that we are partway through developing, and then a particular focus on the performance improvement framework, or the quality performance framework, which is part of that governance structure. The first item, the care governance strategy, is as I say, the overarching framework for all aspects of our health and social care service. It sets out our commitment towards improved quality and greater accountability, and it's structured around 5 domains. Overarching those 5 domains is listening and engagement, and it's our intention that we will pull together a single view of how we engage with the public, people, carers, our workforce, which shows how we will listen, involve and engage with people at all levels of the adult social care journey, from people who make complaints or compliments to frontline staff, through to involvement on our decision-making structures. We then move to the 5 domains. Improving quality and outcomes is the one I want to talk a little bit about, because that's the second appendix that I've brought around driving quality and performance and measuring the delivery, measuring progress towards the delivery of our strategy. The other key elements of our governance: valuing our workforce and leadership, ensuring safety, with particular focus on safeguarding and well-being, finance and resource management. A lot of work has already got underway on that I've alluded to in the previous report. Managing risk and change, which is around resource management, change delivery. In terms of the second report, the quality and outcomes improvement framework, there's a reasonably well established framework for establishing a culture of continuous improvement across the health and social care service, from self-assessment, evaluation and improvement at front line through to a more strategic approach to performance management at a more senior level. The proposal is that we will work now to populate that performance management framework and then bring regular updates on progress to this committee.
Thank you. Are there any questions or any comments? Councillor Linders-Hammond.
Thank you. This is really interesting, and I've always been quite interested in the way, not just how we do care governance overall, but how we listen to people. We often talk about how we listen to people about how they want to change services, but also really importantly is how we listen to people how they are, how happy they are with services. And sometimes I feel that in the past we haven't necessarily talked to people using questions and using methods which are easy for you to understand. And I wonder, and I know we have really important data like from the ASCOF surveys. You might have to remember what that acronym stands for. But I wonder how far can we go, and how can we go towards really crystallising a small number, I'm not going to put a number, a small number of questions as such that we can be asking people consistently who receive our services or have other relationships with us, so that we can monitor how those things change. Because actually what I sometimes feel that we have so many metrics, and this report is not metric filled, but we can do a performance piece for this committee, and we can have so many different pieces of data. How can we crystallise it down to something that we can consistently monitor, that really lets us know, do the people that receive services from the council, do they think that they are decent? Do they think that they are person-centred? Do they think they're shaped around what they need? Because it feels to me sometimes like we have so many metrics and so many different ways of measuring things that we fail to get to the simplicity that we can monitor and that can we explain to the wider public and service recipients. And so I really hope we can move towards that, and I don't can say anything around that. Thank you.
I very much welcome that question, George, and that's really one of the bases behind this. The question is the strategy is to find us in a way in which we can consistently engage with people in a way that matters to people. And what you have is national measures such as the Adult Social Care Outcome measures and various national measures that will come from Care Quality Commission. But when we speak to people, what people want to do is have a conversation with us. And we want, and very much what we want to do is really understand what is people's experiences of our services and how can we ensure that we're continuously improving based upon that. And essentially that's what the strategies is enabling us to provide the foundation to do. And we have officers just now who are working on exactly that survey. That we could do is a very more straightforward survey. And we have two reports that we've proposed for the future forward plan for the committee. One is a co-production strategy, which we really want to co-produce rather than just officers doing. We really want to truly meaningfully develop a meaningful co-production that's co-created, and that to then inform how we really do listening engagement and going forward. Equally, that have these very straightforward surveys that we can bring back to committee that in some ways cuts through all the noise and says actually here is what is the impact that we're having on people in the city. And that's really it. So it's a great foundation.
Thank you. Yeah, so I think that as Alexis has said, there's a piece of work that is underway, which is to understand how we engage with people, how we listen to people, and how we involve people in the design of services. And I think that we have some pieces in place, and some pieces that are missing and that need development. The pieces that we have in place, things like complaints, things like the ask-off surveys, things like the service improvement fora, the pieces that we're putting in place, the decision-making structures, the involvement of people perhaps in performance challenge, but also critically, there's a piece I suspect that's missing around the surveys, which is the people who have something to say about their experience, but don't want to go as far as a complaint or a compliment. What opportunity are we giving for informal feedback like that? So I think that there's absolutely something there. The other factor there is the strategy that was approved in the spring and that's been referenced earlier on. John talked about the delivery plan for that. That strategy clearly sets out outcomes that we need to deliver, and that's how we need to be focusing our energies. Are we delivering those outcomes? If not, why not? It also sets out 30 I statements as well that will demonstrate progress towards the delivery of the commitments in that strategy. So I think what we've got to do is we've got to link this gap that I think we've got around the surveys and the understanding of people's views with the need to gather a view on how well we're delivering our strategy, and that will mean that new questions need to be asked, new surveys, new information will be needed that tailor the data to the strategy that's been agreed in the I statements that were included in that. And so I think bringing the two together is a piece of work we'll be discussing in a performance clinic with officers this week, and thinking how we can get that fast track so that we're getting the right information through. Covers that gap.
Thank you, that's really helpful. I mean, just really quickly to say, I'm sure all 30 of those I statements are really important, but I think when we're looking at things, say, as a committee or more widely, maybe 30 is too much for us to really look at. We need to sort of look at, what are the kind of 4 or 5 things that people are saying, and we can judge against that. Because if 18 of them are what we'd say are those I statements are in a good position and 12 of them are in a bad position, I don't know how that really helps us judge where we're going with things. So I think we do need to look at a smaller number of metrics in some cases. Not to throw the baby at the bathwater, but I do think we also need a smaller number to focus on.
So yeah, absolutely agree. I think what we need are the right indicators in order that we can understand what's going on. We can link the activity and what we know is happening with the experience of people and the outcome metrics. We can form the hypothesis about why people are experiencing what they're experiencing and how what we're doing is impacting on that. So we can answer the so what question. I think and that's what that basket of metrics is needed for. I think separately, you're absolutely right, George. In my view, that too many indicators is as good as having none, because you can't see the wood for the tree. So, from a dashboard perspective, you then need to narrow it right down so that we've got a very clear focus on what's important. I'd agree.
Thank you for that. Can I add something myself along the same line before I give the floor to Councillor Milsom? I think what would be important in that context is, rather than necessarily have something formal, and I think that's what George was referring to at the beginning, is have like an ongoing opportunity for people to say, you're doing really well in this, or actually this really doesn't suit me, or I'm really happy with the service. Because what we tend to have is we either have the response to surveys that may be or may not be too long and off-putting or whatever, or we get the really kind of serious complaints, but we don't capture what happens on a daily basis, which about our service, as in, are people happy? So it could be like a random exercise, you know, like some of the bills could have 5 very simple questions with an envelope for them to send it back, and but do it rather than at specific times, do it all the time. I don't know whether that is something that is possible. We don't want anything that is expensive, that's what I'm saying.
Absolutely, I think it's a really good point from everybody, and I think from Angela and from George, and I think one of the key things for me is exactly that, is how we get so what we want to get to is a really dynamic process where we understand what's the impact that we're having on people, and ultimately helping us to really quickly respond to feedback that's emerging. And that's part of the work that we're doing behind the scenes as part of this work that if it's approved. And the trick that we're trying to do is reconcile all the national measures that are out there, and that's all the lots of national measures that's out there around adult social care, with all the Care Quality Commission, you know, intended measures coming our way, and recognising that we'll absolutely have to work to these with something that's far more straightforward locally, that we could then say quite simply at committee, here is the impact that we're having on people across Sheffield. Equally, what's the experiences as services, and that's absolutely doable, and that's the bit that we're trying to basically do behind the scenes, so that you have a very straightforward kind of metrics and going forward. And I would say that it's been quite a culmination of a fair amount of work over the last sort of 12 months to do that reconciliation, equally listen to people and to what matters to people, equally to try and do something very, very simple and going forward, and that we could then start to bring to committee and going forward as to what's people's feedback. That's ultimately how we will continue to improve.
Great, thank you. Councillor Milsom and then Councillor Lee.
Thank you. Yeah, I very much agree with George in that suggestion for a simplified, like a really simplified continuous feedback mechanism. And I wanted to say as well that we've talked about this at the previous incarnation of the Health Scrutiny Committee, about the evolving model of continuous improvement, and how that involves the workforce as well as service users. And you know, you've very much got the two. I'm not even going to say the word sides, because you don't want to put people on sides, but when you're talking about co-design and continuous improvement, that it's very much service users and workforce. And I've really appreciated what you've brought previously to that committee, in terms of how you're evolving a new model that is very much based on that continuous improvement idea. And I like George's idea that there should be a really simple level of feedback. I think that's very easy for us to understand and very easy for the public to understand, and in fact easy for those who have contributed to it to understand. So I would really endorse that, and just wanted to note, you know, that I think this is a really good direction of travel. Thank you.
Councillor Lee.
Yeah, just a comment really. I just want to thank officers for all the reports they've put together today, and I know a massive amount of work has gone into this, and also to thank George because he's been involved in much of this, and I think everyone has done an excellent job. But I think it's incumbent of us to really support our officers to get this overspend under control, because when you're having to worry and put all your energy into that, then it takes time and energy away from other work that I'm sure officers want to devote the time to, because the ethos and the values they've got are about quality, good quality care for all the people in Sheffield who need that support. So I think it's incumbent on us to really support them in getting that under control. Thank you.
Thank you, Councillor Lee, and I think we all agree with you on that. So thank you to the officers. So with this report, there are four recommendations to be approved. Are people happy with those? And can we agree? Fantastic. Okay, that brings our meeting to a close. Thank you everybody for attending. Thank you so much for the officers for all the support before and during the meeting and all the reports. And we've managed to finish 9 minutes before the end. Thank you, and see you next time.